Good morning. Today we'll be talking about saving newborn lives. It's an interesting topic and not one I think we've actually covered before. Good morning, Dr. Oyefeso. It's a pleasure to have you on the program.
Thanks for having me. Good morning.
Good morning. We're talking about saving newborn lives, and that sounds really critical. Can you just tell us first about what the problem is? Why do we need to save newborn lives? Do we have a specific problem here in Nigeria? What is it?
Thank you for having me once again. The question about newborn health and saving newborn lives is actually a very big and relevant one for Nigeria. We have, as you all know, we have a high population, but also we have a high rate of infant mortality. We talk about newborns, and as doctors will speak, we speak about who we call neonates, children who are born within the first 30 days of life. You're labeled a neonate. Interestingly, when children are born, there's a critical support that they require in the very early moments of life that oftentimes we find missing. Nigeria has the second highest infant mortality rate in the world. I just want that to sink in a little bit. And depending on the statistics you look at, more than 700 babies die in Nigeria every day. And this is a healthcare emergency. And then we can speak to the reasons why this happens. For example, I'll tell you quickly that birth asphyxia is a big deal. Babies are born, they are not breathing at birth, they are mislabeled as stillbirth. And there's a lack of competence, lack of information, technical skill, and support for many of the providers. So these babies are labeled as stillbirth even while their hearts are still beating, and account for a significant number of this high mortality rates. We also have things like prematurity and infection. I'll just say this, there's an entity that in the popular parlance is what is called the golden minutes, meaning in 1 minute, 60 seconds, if a child is not breathing, someone should be there to help that baby breathe. And that is missing in many aspects in our country. And that's something that needs to be, it's been addressed, but there's still a lot that needs to be done.
Wow, I mean, those statistics and things you've set up are very alarming. I'm sure a lot of people are very sad to hear that number of babies dying. It's a painful thought, really. So when you talk about that support that is needed, that golden minute, what, first can I ask you, what causes them to have this birth asphyxia? What causes them to appear dead, as it were? And then before I go into how, people should identify them and notice, that they're alive or not alive, and then what else can be done. But first is why? Why do they come out appearing stillborn?
Yeah, thanks for the question. In reality, babies don't breathe when they're inside their mothers. Most lay people don't realize that. Babies don't breathe when they're inside the mother. The function of breathing is essentially to bring oxygen into your blood system, okay? But in a newborn, a baby is able to benefit from the presence of the mother. So based on the placenta, the placenta extracts oxygen from the mother's system into the baby's circulation, obviating, removing the need for breathing in a newborn baby. That being said, when the baby is born, and we cut the cord, baby, it leaves the mother. The baby is now supposed to take over breathing for itself. Somewhere within that period, there's a transition period that is supposed to happen, whereby the baby is supposed to now initiate breaths. But the birth process itself can be stressful for the baby, and there are many other reasons why that could happen. But at the end of the day, we can have a baby that is not breathing on its own. If the baby is not breathing on its own, then we're now dealing with what we call apnea. the cessation of breathing, absence of breathing. And we have what we call primary apnea, because we have primary apnea. So a baby that is not breathing at birth, the provider needs to stimulate that baby. So the things they're doing, wiping the baby, cleaning the baby, essentially help in the process of stimulation. Although there are some other crazy, weird things that people do. We won't get into that. But when you stimulate a baby in primary apnea, the baby responds. But also, popularly, with this, some of our people will spank a baby. But a baby that is now in secondary apnea will not respond to any of those stimulating efforts. None of that will work. A baby in secondary apnea has to have someone help them breathe. We apply an ambu bag with a face mask and a suction device, push air into the baby's lungs in order to help the baby breathe. Many of our providers are unable to achieve this. Now, granted, there are many people who are doing these things, but in so many places, depending on the skill level, the cadre of the healthcare worker who is managing the birth, and bear in mind, Dr. Pamela, more than 60% of our women don't even deliver in a healthcare facility. So that there is a loss of opportunity there, and these babies do not get the kind of care that they deserve. I'll say quickly, there's a video that I saw on Facebook, and the video shows the baby not breathing at birth, and then the healthcare workers doing so much in terms of stimulation, persistently stimulating this baby, moving this baby around. I'm talking of about 7 to 8 minutes that they're doing that, of which eventually the baby starts crying. And when you read the comments, there are so many people that are like, wow, they were so persistent, they did a good job and all of that. So, but there was a fundamental flaw that they did not try to help this baby breathe with a bag and mask. And of course, most people watching who are lay people don't know the difference. So that there is a need for our people to improve in their level of understanding about these processes, so that in some situations they are able to demand or advocate for a better level of care for themselves.
Oh, that's very interesting. So what we're saying is that ideally, people should actually deliver in a healthcare facility, number one. Number two, those healthcare facilities need to be properly equipped with things like this neonatal ambu bag. In fact, I recall some years back when the Rich Clinic, which is a fertility clinic, actually went and distributed neonatal ambu bags in Lagos. Now, to make it more available, are they easily available now? Are those ambu bags readily available in places where women deliver, healthcare facilities?
The short answer is no. And for Bread for Life, I've been working in Nigeria for quite some time now, training healthcare providers on this issue. It's a fundamental issue, but also we also bear the frustration of the fact that something so simple is not readily available. There are also places where even though the ambu bags are there, the providers are not using them. But we also have many providers who have actually never seen an ambu bag before. That's just the reality, as brazen as that sounds. So the short answer
Which kind
is
of problem are you talking about? Are you talking about sort of traditional birth attendants? Who are you calling the providers that will not have seen an ambu bag before? Because I think we need to look at the different categories of care and know who we're referring to, so that we know where, for the people who are listening, we know where to go, or we know where to send people to.
So definitely we have many traditional birth attendants, who are not conversant with this. But we also have some orthodox medical personnel who also have not had that exposure, to be honest with you. And but of course, in our orthodox setting, so to speak, within within the hospitals and all that. That is not the case. But we have many other services that are inadequately supported. So, for example, if we start to look into the local areas, even in some of the primary healthcare centers, you're going to find an absence of the level of support that is required. So the part of what we do at For Breath for Life is that not only do we train the providers, we work hard to make sure that these materials are now available for them. And in particular, the neonatal ambu bag and also the suction devices, because part of the simple process is that a baby is born, there are oral secretions that are there in the mouth and in the throat. You just need a small suction device to suction that out, and then apply a face mask with an ambu bag and push air into the baby's lungs. That's really the simple process. So we try to make this available to these providers where they are. So after training them, they have boots on the ground. They are ready to work in order to use what they've learned. But if you imagine the scope of Nigeria, okay, and there are a lot of limitations, financial, logistics, and all that. But ultimately, we have to keep pushing forward to keep doing what we can, because the more people that are trained, the more people that are aware, the more lives and the more babies are saved.
Thank you, Ukah, for coming on the program to enlighten us about the operations of for Breath for Life. Can you tell us, how does it work? What do you do? Who do you train? Sort of in a nutshell.
All right, thank you for that question. So for us, we look to always partner, because this course is not one that you can do all by yourself. So to be able to provide training and health awareness, so typically we'll partner with hospitals across the country. So in some instances, we can train on their sites within their facility. We train providers, healthcare attendants, traditional birth attendants, we train nurses as well. And in some instances too, we do partner with state governments. In the past, we've partnered with Edo state government to train providers, particularly in 2018, to train providers in Edo state. And over the years, we've trained well over 2,000 providers across the country. So how this partnership work is we provide all the materials that is needed. We'll bring facilitators, depending on the level of partnership we have with the group. So with Edo State government particularly, so we got support from them. We're able to get a facility where we train. So we have our own master trainers. We also get some local master trainers in some instances, and we're able to then train these providers. All right. Afterwards, we give them materials, ambu bags for them to use. We've also done training in those states as well. We got some support from the government over there at Lagos.
But how about private hospitals? So state governments is great, but for example, how about private hospitals that do maternity care? How many hospitals would you say you have trained like that?
With private hospitals, I think we've done nearly 10 of them. Recently, November last year, particularly, we had the training in Lekki, special children.
Alfred Children's Hospital, yeah.
Yes, we had a partnership. We still do have a partnership with them anyways. So we trained quite a number of well over 200 providers in that hospital. And about the same time, we also did partner with UCH as well. So we had nearly concurrent training happening. And also we did have training at Luth as well, about the same period. So it's both public and private partnership across the country. So at the moment, we're exploring and we're having even greater partnership with association like AMPA, NISOM, so who are themselves a collection of master trainers, if you like, and also practitioners who understand this program and know what to do. So they have better reach across the country. So we're able to partner with them and train.
Okay, thank you. So for just in case there are people out there who are interested in supporting this work that you do, because it's very important work, saving babies' lives. Could you have a phone number that we could reach you?
Absolutely. So for those who are interested in reaching out and partnering with us or supporting what we do, you can call this number 070-3722-6349. And if you do wish to shoot us an
Please
email.
repeat. Just
Okay.
repeat that number.
Again, it is 070-3722-6349. And if you do wish to shoot us an email, it is 4breath4life@gmail.com. Number 4, breath, BREATH @gmail.com.
Thank you very much.
Social media. You're welcome.
Thank you. So, Dr. Oyefeso, going back to you, how, it's quite a lot of work that you've done. And I know people who are listening here don't actually realize that you are someone who's actually from abroad, a diaspora, and who's really returning to share knowledge with us. Can you tell us what made you come back to start this excellent work?
Thank you very much. I think if I remember, my memory serves me right, I was actually I was very reluctant to actually leave Nigeria because I just have a strong love and passion for Nigeria. But eventually, for medical training and other exposure, I decided to leave. But with the firm belief that I will come back, fairly quickly. And then along the line, life happened and it became more challenging to come back. And even the environment at home wasn't yet welcoming for us, to be quite honest. So, but I had a conviction that I have received close to free education in Nigeria, close to free medical education in Nigeria. And I know the situation in Nigeria, I know the problems in Nigeria, and it was like having a pebble in my shoe. And I felt that not that it will be unacceptable for me, it's unconscionable for me not to come back to give back to Nigeria and save lives in Nigeria. That anything otherwise would be like me robbing Nigeria. So based on that personal conviction is, how we started the journey of For Bread for Life. Unfortunately, when we started, I spoke to a few of my friends who we decided to start to, they came on the board of directors of For Bread for Life. My very, very close friends who came on board and have been such an unbelievable support in order to get this done. Now, fortunately, while thinking about the issue of Nigeria, I found I made some realizations. Number one is that in many developed countries, they are able to provide resources to keep providers in underserved areas with an incentive. That was number one. And then I felt that that model, certainly could be replicated in Nigeria because we have many underserved areas. Then number two, that we talk about a lot of very fascinating things in medicine, but that the core of the things that people need are really basic sound primary health care, and many of these basic things are achievable. And so the issue of, and of course, being a pediatrician, I have my own passion for children. But the idea, if you imagine just the first semblance of humanity, of life, comes from a child. It's really the very beginning before we talk about any other complicated or involving things, that just on the very first day, no child should die on their birthday unless it's absolutely unavoidable. And if you think about just the impact of it, a mother carries a child for 9 months, and then on the day of delivery, dies. And if you start to strip it apart, you see that many of these things could have been avoided. And then part of the challenge we have in our environment is that not only is that these things happen, but we don't take adequate steps to prevent them from happening anymore.
So
So
quickly,
our
before
role,
I want you to quickly, I just want to drop you there because we don't have much time. And I want you to talk about, because we talked about prevention. We talked about steps to prevent these things from happening. What should be done?
what should be done? We have to train as many providers as possible. Many more providers has to be trained across different levels. Now, information has to get to the homes, has to get to the community. Mothers need to be aware. The more sophisticated and informed mothers are, the better the decisions they're going to make for their care. Remember, I mentioned that we have the second highest infant mortality rate. We also have the second highest maternal mortality rate. So that pregnancy and delivery are perhaps the two most dangerous things for a woman in Nigeria. Women need to be aware of that. Sophisticated women need to be brought on board, women who have resources, who are informed, to actually also educate other women and grow the network. And we have to raise the standard of care. This is another important piece. There must be a skilled provider present everywhere a baby is being born. It's just the basic minimum. These are unequivocal that we just have to. They're pertinent things that have to be in place. And if these things are in place, and people are more informed, workers are more supported, facilities are better funded and better run, definitely we can prevent these things from happening. And it would be bereft of me if I don't mention about other issues like prematurity and infections. But overall, for Bread for Life, we were making our own humble efforts, working with other local entities. Partnerships are critical. And there's such a big need for more synergy and collaboration around these problems. Because with better synergy and collaboration, so much more can be done, without a doubt.
That's fantastic. Thank you very much. I think just to check, do people have to pay to get trained, or do you have some free training sessions that are available for people from time to time?
As at this time, all our training sessions are free because we're
That's
having
fantastic.
to bear the brunt and the cost of all that. Because if we were to wait that people must pay for the training, we would not make the same level of progress. There won't be the same level of enthusiasm. We have trained thousands of providers across the country, and currently we have partnerships in Lagos, Ibadan, Port Harcourt, Asaba, Enugu, Zaria, and Maiduguri, based on our local partnerships. And we're hoping to grow those partnerships and increase the footprint across different, more parts of the country.
That's fantastic. So that's for Breath for Life at gmail.com, if I remember. I think it's for people who are out there who are listening. If you want to be a donor, if you want to be a provider, if you want to get training yourself, if you want to partner to train others, I think this is such an important aspect that we all need to sort of join hands to make it happen. I really believe so. So can you tell us of some of your success stories?
Oh yes, it's been profound. We've had many of our trainees who have come back to give testimonials. These are people who they see babies that in the past they would have walked away from, that this is a stillbirth or what have you. And they now remember what they've been taught and then start the steps of neonatal resuscitation. Because it's, to be honest with you, is almost magical if you were to experience it. Because that baby is not breathing, and if you stand across the room, you would think that the baby is not alive, but the heart is beating. And once you apply that face mask and suction device, and you start to push air into the baby's lungs, the color change starts to happen, and afterwards the baby starts to cry. So we've had many of these testimonials across. We've had mothers who have come to us who remember how they have lost babies in the past, and they have seen a difference from what these providers have provided. I'll quickly mention that we also facilitate even free open heart surgery for children, for needy children in the country. And the testimonials from them have been amazing as well, because we have children whose families can't afford millions of naira for open heart surgery. And we do what we can to facilitate bringing providers in to get that done. And the reality is that there is a need for so much more. And we're grateful for the opportunity to talk about things like this, but with the core interest to save more lives and bring more people into the work.
Okay, that's wonderful. So, I think it's really wonderful work that you're doing. And I know that there are people out there who'd be happy to actually reach out to you, particularly when they know it is free. And for you to bring on this additional aspect of cardiac care, these are things that we really do need in our country today. So can I ask you, do you have any last words for our listeners?
Yeah, I just want to appeal to everyone out there to realize that we have some serious challenges in our country, and the value of anybody's life is inestimable. Nobody should die a preventable death in our country. Babies should not be dying like that. Women should not be dying at this rate. It is unacceptable that Nigeria will have the second highest infant and maternal mortality rate in the world. In the world. So I just want to make the appeal. We are doing the little that we can, but we can't do much without the help of well-meaning individuals and other entities. I want to encourage there are many organizations that are doing good work. And I want to encourage everyone to break down the silos, to be able to work more collaboratively. The resources are limited. And I want to also push for our women to be more informed. Moms, when you're pregnant and you're going to have a baby, the place you decide to have your baby is perhaps one of the biggest decisions you'll make in your life. Your life can literally depend on it. Make sure that the place where you're going to have your child has your best interest at heart, that they have the things that are required in case you and your baby have problems, or they have a system in place that you can move to a higher level of care. Talk to your friends, pay attention. There's so much of information out there, and we can make better decisions. Every life, as we say in For Bread for Life, every life matters. Thank you so much for having us here. We're truly grateful.
Thank you. Thank you very much.
Thank you so much.
Thank you for watching. Please like, share, and subscribe for new video updates.